So if a patient is being advised to have a C-section, then it's important for the medical team or the dermatologist to liaise with their obstetrician, because we need to take certain factors into account, including where the psoriasis is, so whether it's going to affect the actual surgical incision, and also the treatments that they're on and whether that might impact potentially, for example, on wound healing or infection rates. So it is very much, again, emphasizing that need for that open dialogue for the team that's looking after the patient to weigh up the pros and cons and then give the correct advice to the patient. So there's no doubt that we know that psoriasis is a disease that is inherited genetically, and what we do know is that there are multiple genes. It's not one single gene that's passed on. What's reassuring is that there isn't a guarantee that if parents have psoriasis that their child will definitely inherit the disease. So we normally would talk about figures. For example, if both parents are known to be affected by psoriasis, then there's around a 50% chance of passing it on. But if one parent is affected, around a 16% risk. It isn't for certain that the child would inherit psoriasis. And then also we should consider the fact that the field is moving forward dramatically now in terms of advances in understanding. So we would hope that then, as we've seen in the last 15 years, we will continue to have better and more tailored treatments to offer individuals. So in the patients that choose to breastfeed, there's no doubt that we need to address several issues. Firstly, establishing the breastfeeding, and that may be a bit more challenging if patients have lesions on the breast, and that may impact on breastfeeding. And therein lies, again, that dialogue with their healthcare professional about appropriate topical treatments, for example, having the support of a midwife or a visitor who can help the person to persevere and to be able to initiate the breastfeeding. The other issue as well is that some individuals may be on treatments, oral treatments, for psoriasis, and it's important to mention that when an individual is treated with cyclosporin, they should not breastfeed when they receive that drug. But with the other biologics drugs we talked about earlier, that is slightly different. So for women who are planning to breastfeed, I think it's very important that they have that conversation with their healthcare professional, their dermatologist or general practitioner before the baby's born. And I think to get as much information as they can have to hand before the baby arrives would be ideal. I also think it would be very helpful if they had knowledge about the creams that they might want to use and make decisions about what they would be doing with their medication around the time of delivery of the baby. And then of course, if they could pass that information down to their midwife, to their health visitor, that would support them in being able to initiate breastfeeding. I think it's incredibly important as well that the women are offered an appointment around the time of delivery, and certainly with my patients we try and plan it that quite quickly after delivery they have an outpatient appointment if they're able to make it, and that's there as a safety net, because we do know as well that some individuals may experience a post-delivery flare of their psoriasis, and therefore we want to be there at a time to intervene and to support when that's taking place. So patients do talk about that life balance after the baby's born, and there's no doubt, as we've discussed, that individuals may be getting less sleep and they may be feeling under more stress than usual. And what's very important with that again is that those conversations take place before the baby's born, and that there is a clear plan in place for the person so that they know what the next steps would be. For example, if they find they are under stress, their skin is flaring, then they know that they have an appointment, or they know they have a treatment that they can turn to help see them through that particular flare-up. So again, ideally it's that planning aspect of preempting a problem or having a clear management strategy so that we know that if one thing occurs, we will do a certain type of management, but if another occurs, then we have another option. And I think it's important for patients to know that they have those options and that they know that they have that level of support.